Let's eliminate the greatest healthcare regime in the history of the world that basically single-handedly provides healthcare innovation to the entire world. The place that everybody goes when they want medical care. Let's eliminate it. You know, like, what did that ever do for us other than be the greatest achievement of healthcare science ever? Other than that, come on, move on. This is the sign of the radical and the sign of the reformer. Is they will bulldoze centuries of work on a whim. They don't care. They have no respect for anything. They are utterly filled with pride. And so they say, whatever, I don't love it, so yeah, I just don't love it, so just bulldoze it. Who cares? We'll probably be able to recreate the culmination of centuries of science in like a day, right? And add on to it something that has never succeeded ever, which is government control of healthcare. Let's whatever, I don't know. Who cares? It's only a sixth of the economy and the healthcare of 300 million Americans. Whatever. How ridiculous. How flippant. What an unserious person to say that sort of thing. Also, it's a lie. Everybody has access to medical care in the United States. She can't answer it because you're right, people won't get to be able to choose their doctor. They won't be able to get to choose who provides their health care. So she has to answer a different question. She says, yeah, okay, well, but everyone is going to have access to medical care. Everyone in the United States has access to medical care. Illegal aliens in the United States can access medical care whenever they want. She is right that the system is terrible. She's right. It's like that Churchill quote about democracy. Democracy is the worst form of government except for all of the others that have been tried. The American healthcare system is the worst form of healthcare other than all the other systems that have been tried. That's true. It's so frustrating. I go to the doctor once every 50 years, and so I go get a checkup or something, and I'll get random bills for this, and it really costs $10,000, but you're only paying 3 installments of $28, and somebody's paying this, and it's all of the costs are hidden from both the providers and from the customers, so you're not really making decisions based on any sort of market incentives. It's wide, full of corruption, full of abuse, full of inefficiency and fat. That's all true. Kamala Harris's idea is worse. Government healthcare is worse. It's true. Our current system has a lot of bureaucratic paperwork. Do we really think that a government takeover of healthcare is going to result in less paperwork? Have you been to the DMV? Have you been to, the Social Security office? That's sort of the crown jewel of government paperwork. When has the government ever reduced paperwork? At least when I get some weird bill or something from my insurance provider, I can call up my insurance provider. I can call up the medical office that I go to. Now there are a lot of little boutique medical offices. Now there are certain things where you pay a little bit of money and then you get to this and that, okay. And you get to at least tailor it more toward your tastes. Well, still, we have a very robust social safety net that takes care of everybody. We have a very generous Medicaid system to take care of the poor. We have a very generous Medicare system to take care of the elderly. We have emergency rooms for people who aren't even U.S. citizens. We just give them medical care. We have a basically wonderful healthcare system with a lot of inefficiencies that you could fix or make a little bit better. Gradually, mind you, not all at once, not ripping it to the ground like this lunatic reformer Kamala Harris, but gradually instituting reforms that would make costs clearer, that would free up some of these markets, that would allow for a little bit more competition in certain places, that would lift some regulations, that would include tort reforms so that you don't have crazy malpractice laws where doctors are afraid to do anything, ordering a zillion tests. There are a lot of reforms that you could make gradually to make the system even better than it is. Or you could take the Kamala Harris, Alexandria Ocasio-Cortez, Democrat Medicare for All approach, which is to bulldoze the greatest healthcare system ever on which the entire world relies, and then just cross your fingers and hope that a system that has consistently failed will work here just 'cause. Those are your options. Those are your two options. We'll see which one they do.